Well, hello everyone, and thank you for joining us for our first ever expert discussion about PeriAcryl on YouTube. My name is Stephen Blacklock, and I will be your host today. And I am the COO of GluStitch Incorporated, the manufacturer of PeriAcryl. And for those of you who are not familiar, PeriAcryl, which comes in a little bottle just like this, is a cyanoacrylate tissue adhesive that is useful in a number of periodontal surgeries. My co-host today is the man, the myth, the legend, Jamie Sisler, VP of Sales for the same company, GluStitch. Jamie attends all of our congresses, conferences, our workshops around the world, of course, when they're happening. And Jamie, it's nice to be with you today.
Nice to be with you as well. I'm looking forward to those conferences starting up again. So yeah, nice to be with you now, though.
So today we have the pleasure to speak with Dr. Ramon Gomez Meda. Dr. Meda is a graduate of Compostela University in Spain, where he is joining us from today. And there is where he received his training in periodontics and implantology. He is an international speaker, and he has his practice now in Ponferrada, Spain. Welcome, Dr. Meda.
Pleasure to be with you, Stephen, once again, to see you once again here. And a pleasure to meet you finally, Jamie. A pleasure. I'm honored to be with you to share, in order to share some opinions about PeriAcryl.
Thank you. Welcome. I just want to throw one thing out there before we begin. This broadcast has been pre-recorded, so questions that we receive, we won't be able to answer live, but we will try to get answers to any questions that are asked in the comment section down below. And without further ado, Dr. Meda, why don't we just start off by you telling me a little bit about how you use PeriAcryl or what you use it for?
Well, I've been using PeriAcryl for some years since I met you, I think in Lima, in Peru, some years ago. And I was traveling all around the world, lecturing, and I came across you, and it was finally a good experience because I think it's a material very handy for in order to use in those cases where a connective tissue graft or the gund is exposed, and in the end, for me, it's a kind of stent, but a tissue glue that can be used very quickly and in order to stabilize the gund. Basically, that is my idea about PeriAcryl.
Well, Dr. Meda, thank you very much for being with us. It's like Steve said, it's a pleasure to have you. I think our existing users and anyone who's thinking about trying PeriAcryl, some new users, will be a great experience for them to be able to see how an expert like yourself uses the product. So what we'd like to do is run a couple of the videos that you sent to us showing you using PeriAcryl. And while those videos are running, if you'd like to speak a little bit about the surgery that is being done and how you're using PeriAcryl in those specific surgeries. So we're going to start rolling the videos right now, and please talk over the footage.
Well, in this video, we are watching a full mouth rehabilitation with immediate implants and finally immediate loading. And as I said before, PeriAcryl was used here in order to stabilize the gund. Part of the connective tissue graft gets exposed because I don't want to mobilize the position of the mucogingival line. Of course, you can use PeriAcryl in every single periodontal indication, periodontal surgery, but in those situations is quite handy, in my opinion.
So how long does it take for you to get it to set, and do you use multiple layers?
I usually use a couple of layers. It's, in my opinion, it's more than enough. You can use 3 or more, of course, but it's more than enough. And before I used a little bit of water from far away with the shireen, but now I prefer to let the gund, a moist gund, and to mix the blood with the PeriAcryl. In that way, the PeriAcryl sets quite quickly, and I don't work much. I wait a few seconds, and after a few seconds, I apply the second layer. And in my opinion, it's more than enough. I get good results. I don't use any other system in order to speed up the setting of the PeriAcryl. But of course, every dentist has a way to do it, you know.
Well, that's interesting because Jamie and I were just talking a little bit offline about the evolution of a product and the messaging that we communicate to our clinicians, our customers at shows, and we've always told them to make sure that the wound is as dry as possible, and they can do that with pressure, with gauze. But now you're saying
with a cotton maybe, but that's another way to do it. But I discovered that it was easier for me to let the wound a little bit moist and to avoid the cotton or to avoid the shearing and the water, you know. But of course, there are many ways to end up with the setting of the PeriAcryl.
Yeah. Well, we
I try to simplify my techniques, you know.
Well, obviously, counting on a little bit of blood will make things easier, of course.
Absolutely. Not too much, you know, because if there is too much blood, you don't have the right stability of the material, you know?
Yeah.
It's only a little bit of blood or a little to let the wound with a little bit of blood, only a little bit, you know. If you have much, you can use a cotton, you know, in order to dry a little bit the wound.
Let's see what we have in our second video.
Mm-hmm. This is a free gingival graft. During the second stage of a GBR procedure, I need a vestibuloplasty and a free gingival graft in order to increase the bound of keratinized tissue, the quality and quantity of the soft tissues. And the PeriAcryl is stabilizing the wound. In that way, sometimes I use less number of sutures than before because I have PeriAcryl in order to be mixed with the sutures. So I speed up the treatment. I don't need a stent anymore because I use the PeriAcryl, you know, mixed with the sutures. And after a couple of weeks, you saw that the PeriAcryl is in there. I didn't take out the PeriAcryl till the patient came to take out the sutures, you know.
Right. That was one question I was going to have there. We saw some follow-up pictures, I think at 1 week and then 15 days. When patients come back, do you typically find that the PeriAcryl is still there after 7 to 15 days and you have to remove it, or has most of it fallen off?
Mostly. Most of the times PeriAcryl is in there. Of course, it depends on how many sutures do you have, what is the stability of the material before, you know. But in most of the case, PeriAcryl is in there. Nevertheless, I don't mind because after 3 days, a few days, everything is done. I only want to protect the wound for a few days. I don't PeriAcryl. Okay, it's good to have their PeriAcryl for some days, but its function is already done after a few days, in my opinion.
Okay, thank you very much, and let's have a look at the third and final video here.
And this one's my favorite.
Yeah, because maybe I imagine because this is a kind of procedural socket reconstruction, not only a socket preservation, because I applied the bone chips in the biomaterial into the socket, but I want to improve to boost the phenotype. In those cases, I need to cover the connective tissue graft with something because most of the connective tissue graft is exposed. Only part of the connective tissue graft is covered on the buccal and palatal side. This is a pedicle connective tissue graft from the palate. And in those cases, PeriAcryl is the best thing I know in order to protect a little bit that connective tissue graft for some days. After a few days, as I said before, if you don't have any necrosis of the connective tissue graft, everything is done. You are not going to have a necrosis after 7 days because vascularization is established during the first days, you know.
Now, talking about vascularization, some people who are not familiar with our product might look at that video and worry about PeriAcryl getting, under the flaps or between the tissues that you want to try and heal together.
Yeah.
So does that ever happen in your practice?
Never. I don't really think that it's possible because as I said before, I prefer to have the gun a little bit moist. Not too much. Of course, your assistant can adjust that kind of humidity, and then between the connective tissue graft and the flap, you have a little bit of blood. So the PeriAcryl is not able to get into the gap between the flap and the connective tissue graft because it's already occupied by the clot, by the blood, even if the clot is not well established. So it never happened to me. It's not possible, in my opinion.
Perfect. I just have one more question, and then when I was hearing you talking about the palatal side and the buccal side, if you're talking about PeriAcryl being applied to those two areas, do you ever notice that a patient either calls your office to complain, or if you know that you need to do something to soften PeriAcryl because it's rough against the cheek or it's rough against the tongue on the lingual side, is that ever an issue? The texture?
I don't usually have that complaint. Of course, some patients are very demanding. But I have in mind the position of the PeriAcryl. So in order to avoid that, if I have to place PeriAcryl in the middle of the palate, I advise my patient do not touch that area with the tongue too much. Let it heal for some days. And if the patient complains, you can take out the PeriAcryl after only 3-4 days, because after, as I said before, I repeat, after 3 days, the wound is stabilized, the clot is well stabilized, you don't have any bleeding, and you can take it out without any problem. But it's not a big issue.
Okay. Jamie, do you have any final questions as we're wrapping up here?
No, I think that's it. I think Dr. Meda did a really great job covering all the questions that we are frequently asked at trade shows. So yeah, we really appreciate having that covered by an expert. It means a lot coming from you. So thank you very much.
A pleasure.
Yeah, thank you for your time. And this is the first time we've ever done this. So okay. I think it went really well, but we might find that we get some technical questions and we need to circle back to you.
No problem at all.
Or perhaps we can create an audience and do this live. We can get questions asked in real time and answer them in real time. So thanks very much one more time. And yeah.
Anytime. It was my pleasure. I think PeriAcryl is not difficult to apply. Everyone using the material will realize that in the end it's very, very easy to work with. Okay.
Thank you.